Well, welcome to this section interview. I am Laurel Barr. I am the chair of the formerly young physician section, now early career physician section. And today we are talking about undersea and hyperbaric medicine with Dr. Chris Allen. Chris, thank you so much for being here. Can you tell me a little bit about yourself and how you got involved in the specialty and the section?
Yeah, thanks for having me. So I'm an emergency physician working out in the San Francisco Bay Area. And I also practice in hyperbaric and wound care medicine, which is pretty typical for those in my field. We kind of juggle a part-time ER career and then part-time in hyperbarics and wound care and other things many times. I got into it because I was in the Navy as a physician and worked with Navy divers. And so you do hyperbarics as part of diving injuries in that practice. It didn't do as much clinical hyperbarics there, but we are trained for it. And so when I was finishing residency, I was kind of looking ways to augment my practice and kind of reignited my interest in hyperbarics. And it's just been kind of off to the races since then. I did a fellowship at Duke for a year, and then have since been in community practice out in California.
All right, excellent. Well, this is a very young specialty, started kind of in the early 2000s. A lot of the specialists are grandfathered in, very small specialty, about 200 people. So I think what's great about this is that it is a small and expanding field, and it might be possible to actually know everyone there, which was a long time ago something that drew me to another specialty that was an emergency. So we don't talk about my former life in neurosurgery.
Okay.
But I do think that's pretty cool. So the main society is the Undersea and Hyperbaric Medical Society, and they have conferences. And tell me about your experience there, just finding your community within this little niche of emergency medicine.
Yeah, I think one of my favorite things about the specialty is this its smaller size and it feels like a very accessible community. I found that at my first UHMS meeting that I went to that, these are people that I knew that I had networked with through the Navy. And you just kind of always are meeting people and just feel very plugged in, particularly when you're doing a fellowship in our community or just immediately part of an international community of people who are doing clinical practice and physiologic research and clinical research in the field. I think it made it really easy to get involved in committee work and really advocate and make a difference right away. And so I found that really nice to find that community within emergency medicine where it feels like I could, make a difference in the practice that I'm doing. It's very helpful.
Yeah, one of the things I really like about going over and over again to scientific assembly is I found some people who also are there over and over, and it's kind of cool because I see them once a year, but I see all the same people. So
Hmm.
probably a great experience to really connect with those people and find your community, and it'll keep you coming back. Just
Yeah.
from you could tell me I'm getting a lot of educational content, but I'm really going there to see my friends and hanging out.
Yeah, I think that's very true. Yeah.
A really great feeling.
Hmm.
And then the other thing to that is that it almost feels like the barrier to entry is low because you're not dealing with these people who have been in it for 50 years, or just have this long, long, long resume. When you feel like you're starting out, that can be very intimidating. So just really talking with the leaders in your field and finding out they're closer to you, and really accessible is also one of those things that also keeps me coming back.
Yeah, I think that's true, and it allows for there's openings in projects that, like I was mentioning, that are making a difference in your community and moving the field forward, which is very fulfilling.
Yeah. And lots of it's a new and exciting field. So there's got to be a lot that you can find that can be researched and can be written about
Yeah,
and contributions to make to the field.
right. It's funny. I think it's like a lot of medicine where there we were doing clinical hyperbarics for many years. Starting probably I think in the technically, hyperbaric oxygen as a medical treatment was done for the Brooklyn Bridge, early 20th century. But we started doing clinical hyperbarics in modern medicine probably in the 60s. And so it's been going on, but that building that evidence base and defining us as a board certified specialty, I think made a big difference in moving the field forward. So that was, that 20 years ago.
Wow. And one things that I thought about this specialty is I've seen an appendectomy, I've seen a cabbage. I have never actually seen a hyperbaric chamber.
They're around, they're kind of hiding in the basement of your many, local hospitals. And you're right, we kind of are a smaller field, and a lot of times there are emergency indications that emergency physicians might be aware of. Carbon monoxide is a very common one, but there's very good evidence on trauma indications for crush injury and necrotizing soft tissue infections. And so we tend to interface more with our surgeon colleagues for those. And so you might not see us doing those things. Um,
And for those of us who don't have the exposure, like I never really did, how can you get involved to find out? Are there opportunities at any fellowship programs to kind of go through or rotate through or find out more about it?
Yeah, I think that's the common way for physicians and medical students to get exposed to the field is on a clinical rotation. And so there are fellowship programs around the country. They tend to be on around the coast in the Great Lakes and Northeast and down at Duke and then LSU and San Diego. And so you can do rotations either as a at those facilities or as an off service resident or medical student to get that clinical experience. Many times it's like a 2 or 4 week elective. And so that's certainly the best way to get that experience. That's how I got into it. I did a 2 week rotation where I was training and where I did wound care, but happened to have hyperbaric chambers there. And that's kind of what got me started on my road. And that brings a lot of useful clinical expertise. So even if you didn't end up doing hyperbarics, I think a wound care rotation is very helpful for any emergency medicine resident to have in your practice. And so that could give you that exposure. And so I think reaching out to your wound care teams at your facility or the fellowship program certainly have formal rotation opportunities if you wanted to pursue that.
Well, what a great excuse to find a rotation opportunity
I
by the
know.
water.
I know, and having good clinic hours for an emergency rotate medicine resident is a nice off-service elective, I think.
Oh, what a great point to that. So get an away rotation by the ocean or a body
Yeah,
of water
right.
with great clinic hours.
Yeah.
Well, that's a good segue into it. If I get through the training that seems like it's going to never end, and then there's a couple of fellowships that you can go to, what does your clinical practice look like on a daily basis?
So I'm about 50% EM and then 50% other things. And so my EM is pretty typical for that, is I'll have a rotation of night shifts and weekends and those types of things. And then my other time tends to be kind of 8 to 5 type thing. And so it's a hyperbaric clinic where we run is 8 to 5, and you're kind of supervising treatments and checking in with patients and doing consults on new patients or seeing inpatient consults. Um, Many inpatient programs do run a 24/7 call schedule that have kind of variable volume. And so, many sites do that. And so there can be some after hours commitments where you're coming in and treating sicker patients. I find those cases tend to be very professionally satisfying because you're kind of doing ventilator and pressors and critical care in the chamber. They're interesting cases that make a big difference for patients. They can, saving lives and limbs and vision is always a good thing. And then my wound care practice is straight clinic as well. And so that's very, very low stress compared to an ER shift where I've got my schedule. I come in and scrape some feet and clean up some wounds, and the patients are very thankful and healing out a wound and getting someone, walking on their limb that they otherwise could have needed an amputation is I think, a really satisfying practice. And that's also kind of 8 to 5, no weekends. It's a nice change of pace from the emergency department.
Wow, what a great. So a couple of things that I heard from you is variety,
Hmm.
critical care, which honestly, managing a ventilator inside a hyperbaric chamber seems really complicated and really cool. Uh,
Hmm.
Low acuity mixed with the high acuity, taking a little bit of call to add some variety, and then having some 9 to 5. And I do want to mention that you're on a clinic shift right now and you haven't gotten an EKG shoved in your face
That's
yet.
true. I know. I know.
Sounds like a little bit better control over your work-life balance than we have just doing clinical shifts all the time. So,
Right. Yeah.
and you're by a beach somewhere. So,
That's
I
true.
am I am doubting why I didn't do this right now.
It's a nice way to kind of spice up an EM career, I think, and that's why a lot of us do it, just to get that variety.
And a close-knit community on top of
Mhm.
it. Sounds like a wonderful career move for anybody who's interested.
Yeah.
So sounds like the barrier is almost just to find out about it. So this is the first step. How
Yeah.
else can we get involved in the section to get into this wonderful specialty?
So we certainly have people who have gone through fellowship and are practicing actively in hyperbaric medicine. But the other part of the section is the undersea part, which tends to be kind of diving medicine. And so there's a wilderness component to that. So a lot of us are involved in the Wilderness Medicine Society, and are involved in diving medicine, which is a whole other thing where we're doing fitness to dive, where patients with medical conditions want to get in the water and be scuba divers or commercial divers where they dive for their profession. And so it's a lot of kind of occupational medicine where we're guiding them. It's injury prevention work. A lot of fellowships are involved in kind of local emergency response and supervision of local dive teams with lifeguard departments or community dive teams that are doing rescues and working with police teams. So there's a lot of variety there. And so we have some members of the section that are primarily diving physicians that don't do hyperbaric medicine. And so we support that as well and support that community. And so being involved in that is similar as, it's kind of forming that community with the section. And so you can, reach out to the section and joining the section can be helpful there.
And I'm just going to put a plug in for if you want to get involved in dive medicine. I got my scuba certification and I just wanted the resort certification, but the extra was just the medicine of it that I already knew.
Yeah,
Um, so probably don't know it as well as you did, but it was really an easy extra step. And now I'm got two more certifications and it was just an
great.
open door and
And
swim
I
with
think a lot of the
sharks and all
community
that
is
stuff.
that way because emergency physicians, we're outdoors a lot. We're doing these things. And
Mhm.
so it's you have the experience as a scuba diver, and then you might take a little extra course, and then you're a subject matter expert. That's how it works with these smaller communities. And so that's very common in our field, I think.
Yeah, low barrier of entry, but also some really fun things to do with the
Yeah.
specialty, both inside the hospital and the clinic, and then outside of it. I
Yeah.
mean, I do not get a tan when I'm working in the emergency department.
That's
This
true.
is an area where you could. Just
Yeah,
saying, might be a
exactly.
sunburn if you see the color of my skin, but
Exactly. And it lets us have conferences down in, the Caribbean and Bonaire and do some diving and do some learning as well. So, yeah.
I never want to go to your meetings then. When's the next
Exactly.
one?
Exactly.
Well, let's talk about the initiatives of the section. There's a couple things going on, safety being one with the hyperbarics. Obviously, you don't want to go down to the bottom of the ocean or in a hyperbaric chamber without being prepared. And then carbon monoxide poisoning updates.
Yeah. Yeah, so the main goals of the section are to kind of to educate to support the national community and bring us together and help with initiatives as well as support our fellowship programs and help people know about the specialty and get clinical experience and then also educate the wider emergency medicine community. And so those two efforts are kind of part of that last one. And so those are kind of two efforts we're doing this year. We updated the carbon monoxide or had some input with ACEP updating the clinical policy for carbon monoxide poisoning, which is helpful. That's a very common emergency indication that many hyperbaric practitioners are doing, where we see that it's a reduction in delayed neurologic sequelae, which is kind of like concussion symptoms that patients get from carbon monoxide poisoning. And in our field, we feel like there's good evidence that it's helpful there. And so we're able to give some input to kind of influence some of that language in the policy there. And then we're doing an effort this year related to hyperbaric chamber safety. So members of the section, we are well aware that there are some risks to hyperbaric oxygen treatments, but when practiced appropriately with well-trained staff and good physician oversight, it's a very safe thing to do. But there have been some accidents and deaths in the United States in 2025 related to chambers that are not being run in a safe way and by practitioners that don't have their appropriate safety practices and training. And so we're trying to give education to the kind of emergency medicine community about, these chambers are likely in your community, that you may have to respond to these chamber emergencies if they do happen, and so you should be aware of how this can happen, and then you can advocate in your community to get safe chambers and to enforce pre-existing kind of federal requirements that should be keeping these chambers safe that might not be fully enforced in your local area. And so I think that's getting the wider community aware of these issues. It can be helpful to keep our patients safe and make sure they're getting good care.
Yeah, what a great reminder that these things are very safe when under the appropriate supervision that we can provide, but when not, it's just like almost everything else we do. You put it in the hands of someone who's not paying attention, who isn't accredited, or who doesn't have the skills and the knowledge set, and then bad things can happen. I mean, I don't think anybody would want to go scuba diving under the sea without any training at all. At least I wouldn't.
Hmm.
But when done properly, it is one of the safest sports out there. So you're going to have a concussion more often in soccer than you are in scuba diving.
That's true. That's a good way to put it, I think. Yeah, it's very similar.
Yeah. Uh, Probably a little more shark bites by like one or two, but less
Yeah.
concussions, definitely.
Yes. You can just kind of push the sharks away. The last time I saw one, you just kind of push them with your camera and they go elsewhere. It's fine.
I don't think I've ever had to push one. Most of them are sleeping, honestly.
Okay. I did some diving down on the Gulf Coast, and when
Oh,
you're doing
yeah.
some spearfishing, the sharks come out. Yeah.
Oh, see, there's so much cool stuff to see in the ocean. I highly
Yeah,
recommend it if anybody wants to get involved. And
for
then you can
sure.
go lionfish hunting too.
Yeah. There you go. Get the reefs going. Yeah.
Yeah, help the environment while we're at it.
Hmm. Hmm.
And get sunshine and get out
Hmm.
of the windowless space that is the emergency department and get some
Hmm.
work-life balance.
Hmm.
I'm thinking that I'm getting involved at the end of this.
Welcome to. We are always welcome to support.
Well, if I do want to get involved, there's ways to contribute to the newsletter. You can show up at the annual meetings, build your community, lots of mentorship opportunities. You have webinars coming up, um, advice on fellowships, opportunities for fellowships, connecting the local community, and then a great place to connect at Scientific Assembly as well.
That's correct. Yeah.
What advice do you have to an early career physician who's looking to get involved?
So I think that the best advice would be to kind of reach out to the section. If you're interested, is to reach out to the section or any local hyperbaric or wound care practitioners. We tend to love sharing our field. And I think trying to doing a little 2 week off-service rotation is the best way to kind of augment your career. It doesn't commit you to any fellowship or change, but I think it would bring skills and get you aware of this other side of an emergency medicine career. If you wanted to reach out further, then talking with fellowship directors and the section kind of help you talk about what that looks like as well. And if you want, you can also, as you mentioned, contribute to the newsletter, or as a med student or resident, we're always doing kind of small research projects and data reviews. There's lots of ways to help out the community and get involved.
Excellent. And go to the website, learn more, reach out to the section, get involved. Thank you so much for being here. I want to end with one last question. You
Okay.
mentioned some cool things, being in the Navy, diving, managing a ventilator. What is the coolest thing that you've seen in relation to this specialty?
I th Coolest thing I've seen is treating severe carbon monoxide poisoning and just seeing that abrupt improvement where we'll have someone come in that is having so much trouble they can't even walk, they're confused, a very abnormal neurologic exam, and I can put them in the chamber and see a noticeable improvement. And we really see that. And so seeing that really acute improvement, and we see that with vision changement, with eye strokes, we see it with diving injuries, with decompression sickness, of seeing that immediate change is very satisfying, and having somebody be able to walk out of the chamber and walk home when they came in debilitated is a very satisfying way to practice medicine.
Wow, what a cool thing to just see someone come in super sick and then leave walking when they couldn't. I've only done that with malingerers and an 18 gauge needle. So
Yeah.
you've
But
actually
that
done
works too. They still walked out of the apartment. That's good
it.
disposition.
It's happened before.
Yeah. Yeah.
Well, I was hoping you were going to say that I punched a shark like Batman style, but you came up with a much better story.
Good, good.
All right. Well, thank you so much for being here today. Undersea and hyperbaric medicine section, a great little niche in the EM community. You can really build your area. You can get exposed to something that's new and be out in the sunshine, which I say from cloudy Ohio, which is
Mm,
probably, well, I'm on spring break and I want to be in Florida where you are. So that's
yeah.
your opportunity to spend your rest of your life where you want to be instead of where I am. So
Okay,
thank you
very
so
good.
much for being here.
Thank you for your time.